Greetings, neighbors. This is Reflections, the show sponsored by the Paducah Cooperative Ministry, where we, all of us together, do God's work with human hands. My name is Gregory Waldrop, and I'm the co-host of Reflections. I'm the pastor at Fountain Avenue United Methodist Church, and I've been here a while. In times past, the other co-host has been Amarai McIntosh, the pastor at St. James CME Church. Amarai has moved, and I'm glad to introduce to you a new co-host, and one you'll enjoy as like we all did Amarai as well. Welcome to Karin Winkel, who's the pastor at the United Church of Paducah.
Good to be here, Greg. I'm looking forward to this.
Glad you're here and glad you're with us.
Me too.
Tell us about, just a little bit about how you've come, when you came, about your background, so we'll know you as a co-host.
Well, I thought I'd learned the lesson of never saying never. I said I would never be a minister, and then I said I would never leave the West. And so I lost on both counts and won on both counts. I'm a Westerner that got blown by the Spirit to Western Kentucky, and have been serving United Church of Paducah for almost 2 years now, and just absolutely love it. And I love Paducah, and it feels like I've lived here for 20 years, not going on 2. So I'm pleased to be here, and I'm excited to be working with you and finding out about all kinds of things, ministries of all kinds in the community. And
we're going to have a good work together.
Yeah,
that's
and
great.
I'm excited about today too, because we have Karin Thomas from Hope Unlimited. You're the executive director there, and Brenda Cooper, a nurse practitioner who's helped design the clinic there and is involved with women there. And we're wanting to talk with you about what you're most excited about. And as a relative newcomer to the community, I'm not familiar with Hope Unlimited, and I'm guessing that probably some of our viewers might be familiar with the name, but not really know what that ministry is and how important it is. So if you would, Karin, tell us a little bit.
Well, Karin, I hope I can put it in a few words, but Hope Unlimited Family Care Center has been in our community for 16 years. And it was originally started by pastors, different denominations coming together, praying about the condition of teenage pregnancy in Western Kentucky. And at that time, Dr. Everett Koop, the Surgeon General, and Billy Graham were also praying at the same time in the East about what was happening across the United States about teen pregnancy. So they were all concerned about this issue, and out of that developed an affiliation called Christian Council of America. And that was for many, many years kind of a love affair with Billy Graham about developing centers throughout the United States that would deal with the issue of teen pregnancy and have a place where the teens could come and be ministered to and loved and not condemned for what they walked into. And so that's how the pregnancy care centers started across the United States, and now there are over 4,000, such as Hope Unlimited across our America. And the new revelation that happened just recently, about 15 years ago, was that the same people got together and they were concerned about, we weren't reaching that abortion-minded, abortion-vulnerable little girl. And she was going to the abortion clinics and having abortion, and then throughout her life, then she was just feeling condemned and just would do things that she would try to do to satisfy her hurt, what she walked in, the devastation that she walked in, and would just be in darkness. You know, she just felt so incomplete in her life. She had nothing to offer. And so they were concerned about that. And so Focus on the Family got with our affiliation, CareNet affiliation, which is an umbrella covering of us that we have. And it's an affiliation, and they're from Sterling, Virginia, and they minister to over 400 pregnancy care centers. And there are legal protection. We need legal protection because we're dealing with an issue that's a controversial issue. And many times there are different things in this world that want to trip us up and make us look like we're not what we are. And so they're right there at a phone conversation with me to make sure that I'm lining everything up properly so that the attack from the world can't come and get us for what we're doing for the Lord. And so they began the center 16 years ago because a lot of people cared for this community and the young people of this community in McCracken County. And it's been a beautiful experience to watch Hope Unlimited develop from just handing out baby supplies, clothing, things like that, to become a spiritual educational center. We've become a medical clinic within the pregnancy center. We have a men's counseling program within the center. Within the center, we have a store to the community. It's just gone off into a lot of branches, and now we're reaching the whole family, the whole family. And that's been our desire and design that God gave me, is that we got to get to the whole family and make the whole family whole. So the whole family's working the way God wants them to. So Focus on the Family presented an opportunity for pregnancy care centers to write a grant to Focus, because their donors had pledged to pay for 640 ultrasound machines to be put in pregnancy care centers by 2010 in the United States. Then you could write to apply for the ultrasound, or you could write to apply for the medical training. Yeah, training, because a lot of the people, such as myself, do not have medical training. And to put something medical, which is so fine and so detailed work, we all had to be educated. So we chose to go with Focus to get our ultrasound machine. And so I wrote the grant. And before the grant was accepted, we had a banquet last year. And one of our attenders was a doctor here in town. And he called me into his office the next day and donated to our medical clinic, which hadn't even started up and running yet, a $70,000 ultrasound machine, which is a Cadillac, Greg, in the ultrasound world. And so God gave us the very best to start with. So then we changed and got training, the medical training, to be able to, and so Focus paid for all of our training. But in the meantime, I was praying for somebody like Brenda to come along, because I didn't have time to develop this program, because I knew how detailed it was medically, and that's not my field. So I prayed, he brought her, and she began to develop the program because it just fits her title, and I'm just going to let her talk about that, because I am so blessed to have her on our team. She has changed so many people's directions in life that were tended for death, and now they have life in their life now. And I'm just blessed to have Brenda, so Brenda, share.
Yeah.
Well, as she said, I'm a nurse practitioner. That's my expertise in women's health. I started out at one of our local hospitals, worked there as an RN in labor and delivery, worked there for 15 years, helped bring babies into the world. And I didn't really see the aspect that Karin has shared with you. But I had the opportunity to go back to school to obtain my nurse practitioner license, and was working in the local doctor's offices. And I would see ladies come in who had had the experience of abortion previously in their life. And many times they would relive it in that setting because they hadn't really dealt with it, hadn't forgiven themselves, hadn't asked for forgiveness. And I knew that there was more to this. There was something that we could do to help them through counseling and praying and sharing God's Word. They learned that they could forgive themselves and that they could be comforted and supported throughout this, regardless of what their experience was. And a couple years ago, I had met Karin. I thought about volunteering at the center. I didn't really know much about Hope Unlimited myself, and I had been here since 1976. They had begun in '89. Working in women's health, I should have known all about it. I knew they dealt with crisis pregnancies, but that's all I thought that they did. So I started volunteering, and about a year and a half ago, she asked me if I would consider developing a medical clinic. That is not something I had ever done before, and it was definitely out of my comfort zone. I know women's health, but developing a medical clinic was a little more than I had ever done before. And she said, if you have the willing heart, God will supply our needs. And she offered me the position, and I was in the position that I could take that on with lots of prayer and many people that God placed in my path to help me along the way. Frankfurt probably knows me by name because I used them as a resource to make sure that our medical clinic was what they expected from an OSHA standpoint, from all the safety issues. I wanted to be sure that we had everything to speak to the health issues.
Now, if I were to walk in, what would I see there? When you talk about that clinic, what is there?
It's a large, beautiful, open building, very welcoming, bright colors. You see a very nice reception desk and ladies there waiting to welcome you in. We have many counseling rooms. We have 2 exam rooms, an ultrasound room. We have a lab where when we are ready to start doing STD screenings, we have it available already, and it is all very private. And we meet the people where their need is, regardless if it's a crisis pregnancy, if they're coming in because they're seeking abortion, we are going to educate them about abortion. We're going to educate them about adoption, and we're going to educate them about parenting. And they're going to know all the information before they make the decision. And that's a decision between them and God. We're there to give them the information, pray with them, share that we have support, love, needs for their pregnancy and for the baby when the baby comes, and just let them know we're there for them.
Sorry, I just want to make sure this is all at the new facility there on
Yes.
Jefferson Street.
Right.
What's the address there?
1101 Jefferson.
1101 Jefferson.
Right on the corner, across the street from Child Watch.
Right. And it used to be the ceramics place
Right,
that
Western
you've
Tickets
restored.
Ceramic.
And
Oh, yes.
yeah, great. So it's downtown Paducah, 1101 Jefferson. And tell me also, is this clinic specifically about women's health, or is it broader than?
It's broader than that because we want to bring the father in and the family, and it's a Christ-based center. So we're unique in that area. We want the family to mend together and to heal and to be healthy, and that's what we want for the community. So many times the dads are separated from the moms, but we want to help them grow and mature the way God intended our families to, with the father at the head of the household, if that's possible. And in some cases it's not. But we do have all the classes, all the support available to them if they choose to utilize those services. And it's just to let them know they're not out there by themselves in a crisis with no hope, no one to care for them. We let them know we're there. They can call us at any time. We have a 24-hour hope line that they can call.
What's that number?
442-1166, and that's day or night. Someone is available to talk with them, counsel them, and welcome them into the center. We have appointments available as well as walk-ins, and we never turn anyone away. We're there to meet them where they are, where their needs are, and if we don't have the resources available for them, if it's for housing or financial need, we're aware of the resources within the community to help direct them and guide them in that way.
Are there any fees associated with this?
Most of our fees are free. We are looking into Medicaid being reimbursed through the medical clinic with Medicaid. But again, even if they are not accepted with Medicaid for whatever reason, we don't turn them away because of their inability to pay. But that is an issue we're looking at. As you all may be aware, medical services are rather expensive, the equipment and the supplies that we need to treat the patients. And so we are considering Medicaid reimbursement just to help maintain our supplies to support our patients that come in.
Now, I'm guessing you lead a cadre of volunteers there as well, or maybe paid staff as well? What?
It's mostly volunteers. We have total 9 staff and approximately 25 volunteers. If it weren't for our volunteers, we wouldn't be able to do the things that we do. They're our backbone.
And you could, I guess, use volunteers if people were interested.
Always,
You
whether
can,
medically or in Hope's Closet. That's a community store where the community can come in and buy things for their family very inexpensively, but it's also available for our patients and our clients who they come in every couple weeks and they earn points, and those points are like money that they utilize to buy the things that they need in their store, builds their self-esteem and accountability by allowing that service for them.
But what I want to share right there is we're so excited. We have developed this program. It's called Learn to Earn, because I have been with the ministry 14 years and I have seen so many repeated clients that were going nowhere in their life. So we worked hard in developing this program to, when our counselors counsel these young people or these families or this single dad, that we get down to the bottom of what is the weakness in their life, what is the real weak part of their life. And so we have, say it's self-control. So we have a study on self-control that we put this young man in, and what he can do is that when he makes an appointment, he gets points. When he's on time, he gets points. When he brings his homework, he gets points. When he goes to church and has his pastor sign his bulletin, he gets points. When he looks at a video and does a video study, he gets points. So he's earning all this, but yet he's learning this new issue of control in his life, that he can control himself and that he will be a better person at it. And it can kind of string out like 3 weeks, or it can string out 12 weeks, whatever it takes to get him through this study. And I have seen such a change and an attitudinal change in our clients that are in this program. It's just amazing. And so we're excited about that program. And then they've just developed a new program for the first time pregnant girl, never had a baby before. She and her boyfriend have never had this occurrence in their life, or this young couple has never had it. So will you tell them about that? Because that is so phenomenal too.
It's incorporated into the Learn to Earn program, and there are classes for the fathers, there's childbirth classes, breastfeeding classes, baby care classes, and a lot of our area nurses from the hospitals are volunteering their time to teach the classes. And just for signing up and being interested in the classes, the patients and the clients get a little welcome gift, and halfway through the process they get maybe a father's, it's a little belt that's got diapers and powder and the little things that they would need to care for their baby. And then at the end of the process, once they complete all of their classes, they're able to receive a baby bed, a crib. And we realize those things are very expensive, but we also know our community has been very gracious in supporting us, and we know that God will provide the needs for these kids. And just to see someone come in without hope, in tears, not knowing what they're going to do, they find that they're pregnant, they have an ultrasound, they see that heart beating on that screen and realize there's actually a life in there and not just some clump of cells that they don't even feel at this point. To see their life change within a matter of maybe 45 minutes from I need to have an abortion to there's really someone in there for me to love and to love me back. It's amazing to witness that. It's such an opportunity, and it's a privilege to be involved in someone's very emotional, intimate part of their life, that they trust us enough to tell us what's happening and to share that with us and to see how their life changes just by seeing the truth, seeing that there's a baby there. And they may not all choose life. We understand through Focus on the Family, 95% of moms do choose life after seeing an ultrasound. If that was not available, it would only be 67%. But that is so obvious that there's a life inside them, that statistic, you can't ignore that. And just to see that they do have that hope and that they know we're there to support them, it really is a privilege just to be there and witness that. It really is.
She was going to address the fact that the little girl that chooses abortion, and we always tell them, we prepare them, we want to educate them so they'll make an intelligent choice and a heart choice for their life and their own baby. But if they should choose abortion out of fear, which they always do, that we welcome them back with the love of God, and that we have a Bible study for them to take them through their healing process and their forgiving process and forgiving others that, we're enforcing this dilemma on them. And it's a 12-week study, and they come back, and it's called post-abortion education. And they come back and go through that, and they rise up like beautiful little brand new roses, I'm telling you, and they are ready for a brand new life of freedom of their past. And some of them even turn around and volunteer at the center, stay right with us, until they feel more confident, of going out and trying their newfound life in the community.
I know the various media report that teenage pregnancy numbers are down, but I'm wondering what kind of numbers you all are seeing and what kind of experience.
We just talked about this out in the parking lot, and I'm so glad you addressed this, because the media always wants to say contrary to what's going on. I'm sorry, I've lived so long and I've seen what the media can do, and they can give false word out there so that the people will just sit back and relax and not do anything. And we were looking at the young people on this campus, and I just read in a report recently that 74 to 80% young people on our campuses today are all sexually involved with each other. The dynamics of it is still stronger, and what it's done, Craig, is that it's gone down into the younger lives. We have 12-year-olds that come in, 13, 14, 15-year-olds. See, it's moved from the statistics that used to be 18 to 23, now it's down to 12 to 18. So that's where the intense pregnancy is now.
Yeah, the pressures.
That's just so sad. We have, we have a maternity home. We have 15-year-olds out there at that maternity home that are pregnant, that live there, that we're trying to educate and, get them in school and get them on the right, pathway of life. It's in the younger kids. So when we go to schools or we go to churches, we talk to the middle-age kids, the middle school age kids. That's where we've got to get our strong program about abstinence and abstinence only till marriage. So the work still goes on.
Oh, yeah.
The work still goes on.
Well, it's clearly a passion and a calling to both of you, and I'm very moved by the depth to which you go to minister to not just these young women, but to their families. It isn't just a little slice that you're dealing with. You're dealing with whole people and whole lives. How do you sustain your passion for this? And to that, I add, what resources are you using? You've brought books with you. I'm wanting you to talk about what it is that feeds you for this ministry that you're so clearly called to do. Would you share the books that you've brought?
Well, we always start out with prayer and praise in the morning at the center at 9:30. Everyone in the building, whether it's a patient, a client, a volunteer, staff, we all gather at 9:30 every single morning to lift up those needs within the center and within the community and our nation. There are so many needs right now, as everyone knows. And then on Wednesdays, we also do a Bible study together as staff. At home, of course, we all have area churches. Every church is represented within the center. It's a very interdenominational, whether it's Methodist, Lutheran, it doesn't matter. We're all one family. We're all Christians. And God is what sustains us. Power of prayer. And I brought along Jim Cymbala's book, Fresh Wind, Fresh Fire. That's just one of the books I read. Just reading and knowing that just that fervent prayer, God is going to answer prayers, and it may not be our timing, but it's His perfect timing. It's always His perfect timing, and that just reminds me and lets me know He's in control at all times, and I'm so thankful.
Great.
Yeah. You brought a book? it
Yes,
looks
well,
like?
God's Word is really our authority over the ministry in our lives, so we have our Bibles, and as she already said, how many times we go to it for direction and power, and strength. But also, I take all of our directors in the ministry, and there's 5 directors in our ministry. I take them through this book on leadership, so that it says how to develop a clear sense of identity and direction as a healthy leader. And it's just fast reading, but you can't read it fast because it's so meaty, and it just hits you where you are lacking in your leadership role. It's really good. So about 3 times a year I take our staff through this book. So this is good for any ministry or any
Healthy
agency.
Leaders.
Yes,
Keith
by
Yoder.
Keith Yoder.
Great.
Wonderful.
Very good.
We're about out of time, believe it or not, but I want to make sure we get the address and the phone number again for how we can connect, our listeners can connect to you.
Okay, come and see us at 1101 Jefferson, across from Child Watch. And our number is 442-1166. We have
Great.
so many numbers I get mixed up.
That's great.
442-1166.
That's great.
Very good.
It's a good gift, what you give to us and to our community. Thank you very much. If you have a question for them, certainly call them directly, but if you want to have a question, or maybe you have a suggestion for a program we could have here on Reflections, you can contact us either at PCM by phone, or you can write us an email at pcm@hcis.net and put Reflections in the subject line. We'll try to respond to you, get your question to one of our guests, or consider the program suggestion you have. We are very glad you all have been with us.
Oh, thank you so
Thank you for
much.
being here.
Thank
We're
you.
glad you all have been with us as well.
Thank you.
We'll look forward to seeing you all again as we share and host Reflections, sponsored by the Paducah Cooperative Ministry, where we, all of us together, do God's work with
That's
human
right.
hands. We'll see you next time. Shalom.